What's up, guys? It's Dr. Price, and I'm here to help you prepare for the USMLE. I'm the CEO and founder of Action Potential Mentoring, and I'm currently in vascular surgery. So let's get this started. Thank you again for joining, and let's learn and let's get better together.
So what can you get with neuropathy? You can get stuff like foot drop, or you can get something like wrist drop. All right, and let's just make a little integration here. When do you usually see foot drop and wrist drop? All right, so we'll swing this down here. So foot drop, and this is going to be a real throwback back to your anatomy. Usually you get this with common peroneal nerve damage. So common peroneal nerve damage. And you better bet that this is a test question 1000%. In fact, I would argue that pretty much everything that we've said today is a test question at some point in either UWorld or any of the other major test banks. Okay, so how do you damage your common peroneal nerve? So usually that's from a fibular neck fracture. So if you're feeling your fibula, so that's on your lower extremity on the lateral aspect of your leg. If you feel kind of on the lateral side, the part that's sticking out, that's your fibular head. And so right below that is your fibular neck. And so your common peroneal nerve loops right around that before it splits into the superficial and deep peroneal. Okay, so that's super, super high yield to know that if somebody hits you on the lateral aspect of your lower leg and fractures that fibular neck, boom, common peroneal nerve damage, you're going to end up with foot drop. All right, so really, really high yield to know. And while we're talking about it, let's just talk about what the peroneal nerve does. All right, so the peroneal nerve, like we said, is going to split into two nerves. All right, so it's going to split into the deep peroneal as well as the superficial peroneal. So let's draw this out here. So common peroneal splits into the deep peroneal. Y'all didn't think you're getting an anatomy lesson out of this topic, did you? So deep and superficial peroneal. All right, and so the deep peroneal, really, really high yield to know. This is going to do the anterior compartment of your lower extremity. All right, so from your knee down, it's going to do that anterior compartment. All right, so what do I mean by that? That's going to be your stuff for dorsiflexion. All right, as well as like your toe extension. Those are like kind of the main things. Okay, so if you feel down on your leg right now, if you feel your shin, and you lift your toes up towards the ceiling, right to the right of your tibia, you can feel your tibialis anterior muscle contract if you're lifting your toes up to the ceiling. So that's going to be your dorsiflexion muscles. All right, so the deep peroneal nerve is going to control that. So if somebody damages their common peroneal, guess what? That means that you're not going to be getting innervation to these dorsiflexors either. So if you can't lift your toes towards the ceiling, guess where they fall? You get foot drop. Okay, so that's how all this anatomy ties together. And so what does it do for sensation? So that's the motor. Let's just draw it in here as, here's your motor control. But what about its sensory control? Well, this is another board question. It does the first dorsal web space of your foot. All right, so this is super important because they're going to give you a question, and it's going to be pointing you towards deep peroneal. And they're going to say, what else would you lose? And the answer is first web space of the foot if your deep peroneal gets damaged. Okay, so how do you damage the deep peroneal? Well, you can get it from trauma. So you could get any kind of like ankle trauma that can damage your deep peroneal. Also people with like ski boots, oddly enough. So if the ski boots are too compressive, or any kind of high knee-high boot that can compress on this nerve, then you can actually have decreased dorsiflexion and toe extension. All right, so you get that foot drop, AKA steppage gait. So you'll see foot drop also called steppage gait because they have to lift their leg up so high with each step. Okay, so that's really the deep peroneal. So let's talk about superficial peroneal. All right, so superficial peroneal, that's going to really play a role with your ankle eversion. So let's do motor here and then sensory right here. All right, so for the motor, it's going to do your ankle eversion. And so that's going to be your peroneus longus and brevis muscles. And those are the two muscles in the lateral compartment of your lower leg. All right, so if you put your hand down the lateral side of your leg and you feel directly on the side, so completely directly on the side of your lateral calf, you're going to be feeling the peroneus longus and brevis muscles. All right, so if you evert your ankle, which is basically like if you pull your legs medially, like your ankle medially, you can feel those peroneus muscles contracting. All right, and then for sensory, it's just going to do sensory on the lateral aspect of the leg. So lateral lower extremity. Okay, and it also does the whole top of the foot besides the first web space. So it does lateral extremity and dorsal foot besides the first web space. Because what did we say did the first web space? Boom, your deep peroneal. So if you drop something hot on the stove and it splashes down onto your foot and you feel it burning on the top of your foot, what nerve is it? Well, if it's anywhere besides the first web space, it's the superficial peroneal. If it's the first web space, well, it's the deep peroneal. All right, so that's how they could test you on your sensation distribution for your foot. Okay, where were we going with this? All right, we were talking about foot drop and wrist drop. Okay, so what causes wrist drop? So let's tie this in now. So wrist drop, well, you got to think about it. If you drop your wrist, that means that you're not able to extend it. So what is the extensor of your wrist innervated by? That's going to be radial nerve damage. All right, so this is one of my favorite mnemonics because it's gotten so many questions, and if you have a hard time remembering what nerves innervate what in your upper extremity, this will help you. So the mnemonic is the radial nerve is the best nerve. So write this out with me. Radial nerve is the BEST nerve. All right, so what you do is you write BEST down the side of your screen. And so the B stands for the brachioradialis muscle. All right, so this tells you exactly where it is. It's in your brachium in your upper arm, and it's also in the radial region. And guess what? That's the B for the first thing that the radial nerve innervates. The E stands for all the extensors of your upper extremity. All right, so anything that is an extensor or has an extensor function is controlled by the radial nerve in your upper extremity. That right there is a godsend for remembering on tests. All right, the S stands for the supinator muscle. So this is a tiny little muscle in your forearm that helps you supinate your wrist like you're holding a can of soup in your hand. All right, remember the number one supinator in your upper extremity, though, is actually your biceps brachii. So even though the supinator is called the supinator, it's actually a minor action in the terms of supination. So it has a minor effect compared to the biceps, actually. And then lastly, in the BEST mnemonic, the T stands for triceps. All right, so all three heads of your triceps are innervated by the radial nerve. So right here, you got everything that the radial nerve does. Brachioradialis for B, extensors for E, supinator for S, and then triceps for T. Okay, so we said if you have wrist drop, you can't extend your wrist. All right, so you lose these extensors right here. Super, super high yield. You will get questions on this. I know it's anatomy and everybody's like, anatomy, whatever, that can't be that helpful. But these are the questions that you see on the test and you're like, man, I should really know this. So if you get this, remember radial nerve is the best nerve. Okay, so let's rewind here. So we kind of got off topic, but that's how I like to do these integrations is if something sparks your memory, you got to just go with it to keep it fresh in your mind. All right, so we talked about foot drop, we talked about wrist drop. And so those are all side effects of peripheral neuropathy. All right, so any kind of medication or any kind of condition that has neuropathy associated with it, well, guess what? Look for stuff like foot drop and wrist drop in the question stems. All right, because you're going to be able to tie all this together now for any type of question that asks you out about a peripheral nerve injury or a polyneuropathy or anything like that. So keeping that on your differential is really, really essential for the future. All right, and so think about like probably the most common place to get neuropathy. Well, that's people with diabetes. Really, really common. What about people with any kind of other neurodegenerative disorder? So if it's a PNS disorder, look for these neuropathic findings that we just talked about.
Thank you guys so much for joining today. If you found that was helpful, find me on Instagram at Action Potential Mentoring and shoot me a DM saying what your favorite part of today's lesson was. If you have any questions or you'd like some personalized one-on-one assistance with preparing for the USMLE, learning what it takes to become a stellar applicant and matching into your dream specialty, DM me the words VIP Mastermind. Again, that's VIP Mastermind. Talk to you soon.